Anthony Fauci had said that new cases could go up to 100,000 a day if people continue to defy advice on social distancing and face masks. He said states like Arizona, California, Florida, and Texas have each had to roll back reopening plans as cases in those states climb, noting that half of the new cases statewide have been reported in those states. Well, here's some bad news. There are some health experts who argue we're already there. It's just that while we've improved on testing, testing hasn't expanded to the point where we're catching all of the people who have coronavirus, but just don't know it yet. So let's go to this next video. This is former FDA Commissioner, Dr. Scott Gottlieb.
He's talking about 100,000 diagnosed cases a day. The reality is we have well more than 100,000 infections a day and more than 100,000 cases a day right now. We're probably diagnosing, as we've talked about, maybe 1 in 10 infections nationally, a little less than that in these epidemic states where they're falling behind on testing. So the 40 to 50,000 infections that we're diagnosing each day right now really represents 400 to 500,000 infections. Now, those are infections, they're not all cases because not all those people are symptomatic, but probably 200 to 300,000 of them are symptomatic, perhaps mildly symptomatic for a lot of them, so not enough to go get tested. But we're well more than 100,000 cases a day right now. Now, whether or not we could diagnose 100,000 cases a day, actually get them tested and confirmed on PCR tests, that's unclear because the problem is that even though we have a lot of testing in the country, we have well more than 500,000 tests a day, and that's going to continue to grow. We're going to be short on tests in places where there's epidemics. So states like Texas and Florida, they're falling behind on testing right now because the testing isn't evenly distributed across the country. So it might be hard to diagnose 100,000 infections a day for the foreseeable future, but we're well more than 100,000 cases a day right now.
And John, I think he makes a really good point there because particularly in states like Texas, there is not even distribution of these tests in like rural areas, for instance. And that is a longstanding problem in states like Texas and Florida, where the rural parts of the state don't even have as much access to healthcare. I remember doing a story years ago about how many people in rural parts of Texas rely on Planned Parenthood just to get their regular checkups, which is insane. And so it doesn't surprise me at all that some of these areas could have high infection rates without people really knowing it or realizing it.
Yeah, and we sort of, I guess, we're forced to. We've been ground down, or there's just no alternative. We have to sort of just take the information we have and think about the situation based on it. But as you say, the distribution of tests isn't even and isn't high enough to really know the extent of the virus. We don't know. Still, some states lump in antibody tests with the rest of the test numbers that they're sending out. And if you're sophisticated when you're reading this, you can potentially get that. But some states aren't reporting hospitalizations. Florida still isn't doing that, despite lots of pressure for literally weeks now to do so. They might be changing on that in the near future, but not yet. So again, we don't have information on exactly how bad the serious cases have gotten there. And we know that a number of states have sort of played little games with the data and been caught, including Florida and Georgia. And of course, we're not in the end really going to know for sure even close to how many people have actually died because we haven't yet had the time and the resources to go back and figure out which states were classifying people as a bizarre, unexplained spike in flu cases and things like that at the same time that their COVID numbers weren't going up. So it's complicated and we have to use the information we have, but we should at least understand in the back of our minds that it is at best incomplete.
Thanks for watching The Young Turks, really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR. So those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.